everyone, my name is Katie. I am a chairman. The aim of our discussion today is to explore the topic of health policy from the country in Southeast Asia, including Thailand, Singapore, Vietnam, and Philippines. Let our members introduce themselves. Hello, my name is Khonritai Sechu. I come from Thailand.
Hello everyone, I am Azaria Pranawong. I'm from Singapore.
Hello everyone, my name is Nichuan Bongpong from Vietnam.
Hello, my name is Intira Hinanyapati.
That's great. Nice to meet you all. Next, we will let each other to talk about the health policy in their country and we will discuss together and at the end we will have a conclusion from our discussion. Alright, let's start with Thailand. I will talk about the health policy in Thailand. The first one is elderly policy must be taken care of systematically and comprehensively. And the next one, the policy of using health to drive the economy. And the last one is the policy of upgrading 30 baht to treat everywhere by using only ID card. So let's get more detail. The first one is the elderly policy must be taken care of systematically and comprehensively. Promoting healthy aging by family and community. Integrating care of the elderly in terms of body, mind and brain condition to receive health screening, disease risk assessment, health problem prevention, and long-term care. Support materials and equipment that will help improve the quality of life of the elderly, such as eyeglasses, diapers, and dentures. Support hospitals at all levels to have elderly clinics as the way for more convenient access to service. Next, the policy of using health to drive the economy promotes Thailand to be an international medical and health center in terms of medical services, health products, academic services, and research. Health promotion, supporting traditional Thai medicine and alternative medicine, herbs, and Thai wisdom to increase economic value. Expanding to become a center for health services and health tourism of the region and the world community, building on the economy and increasing income of the people and the country. And the last one is the policy that's still in the progress, the policy of upgrading 30 baht to treat everywhere by using only ID card, formerly 30 baht gold card, or the national health insurance right, are the legal rights of Thai people to access public health and medical services for medical treatment, diagnosis, and treatment. This 30 baht gold card will cover the rights of Thai people who have not received the right to receive medical treatment from public servants, state enterprise, and have not received social security. They will have the right to health insurance according to the law, free of charge. This policy was established to develop the 30 baht gold card to treat all disease policy to be more effective, more comprehensive, and of higher quality. People will receive more convenience with basic service close to home, such as doctor appointments, blood tests, and medication. People will not have to travel far to hospitals in the city, reducing congestion and reducing the burden on medical personnel. At the same time, it will promote health promotion and disease prevention mechanism, especially vaccination to prevent disease, such as cervical vaccines for children and women. There will be local health promotion centers and hospice centers to care for terminally ill patients. Most importantly, public health service will be accessible through by using only ID card, and all data will be connected to a secure database so that people can receive service anywhere in Thailand. In my opinion, I think it would be good if ASEAN countries adopt Thailand health policies to their own countries, such as the policy of 30 baht to treat everywhere, which is a policy that will help people access health services conveniently, and adopt the health policy for the elderly because every country has an aging society and the elderly should receive good and appropriate health services. Finally, each country can also export its medicine products to the international market in order to help strengthen their domestic economy.
I'm curious about the policy of upgrading 30 baht to treat everywhere. Can this policy be used the file of sugary If in the case where the patient receive treatment with the policy of upgrading 30 baht to treat everywhere all along, then the patient will have to undergo surgery. Can the patient use the policy of upgrading 30 baht to treat everywhere in this case?
Thank you for your question. For the policy of upgrading 30 baht to treat everywhere by using only ID card, it can be used in case of surgeries and can be used at covered hospitals, or if you use your rights in the other areas, you can transfer your rights 4 times per year and receive treatment immediately.
I agree with you that Thailand has good and interesting health policy because Thai people get a service without charge under the care of the government. Okay, next, we will talk about health policy in Singapore. The Singapore government is committed to keep healthcare affordable and to help needy patients with their medical bills. Healthcare is kept affordable for Singaporeans through heavy government subsidy, supplemented by the MediSave, MediShield, and MediFund. Falling sick is stressful, and worrying about your hospital care add to that. There are subsidy and healthcare plan available. This is a handy guide to help you find out what is available to make healthcare more affordable in Singapore. We will start the 3MS with MediSave. MediSave, saving for your healthcare need. MediSave is a portion of your CPF saving account that you can use to pay for your personal medical expenses or your immediate family members' hospitalization bill. What charges are covered by MediSave? Inpatient ward charges or approved day surgery. Outpatient charges such as chronic diseases treatment, cancer treatment, and renal dialysis. Health screening and vaccination for select group. The next is MediShield, your basic healthcare insurance plan. MediShield is a low-cost insurance plan that helps cover large hospital bills in subsidy ward and select outpatient treatment. What does MediShield cover? Inpatient ward and treatment charges. Approved outpatient treatment. Inpatient psychiatric treatment. Congenital and neonatal condition for newborn. The last is MediFund, a safety net for Singaporeans. MediFund is an endowment fund set up by the government as a safety net to help needy Singapore citizens who are not able to pay for their heavily subsidized medical care at restructured hospitals. To qualify for MediFund, you must be a Singapore citizen, have received subsidy treatment, and cannot afford the medical bills on your own or with the help of your family. Even after MediSave and MediShield, inform the hospital staff and a medical social worker will be assigned to assess your situation and provide assistance. In my opinion, I think that would be good if countries in ASEAN adopt this policy of Singapore, because Singapore has a robust healthcare system that is well known for delivering good health outcomes, and it will have good results in using the 3MS policy for the good health of people in ASEAN countries.
I have a question about MediSave. I want to know where I can use MediSave.
You can use MediSave at any public hospital and MediSave accredited private hospital, outpatient clinic, and medical institution.
I'm completely with you on this. Saving for future medical expense is important as the need for medical care and hospitalization increase as one grows older.
Of course, saving for future medical expenses is very important, and I think everyone should pay attention to this.
Okay, let's talk about the policy in Vietnam. First policy is Vietnam guarantee world-class health standards for LGBTQ+. The Vietnamese Ministry for Health recognized that sexual orientation and gender identity are not considered disease. It brings life to LGBTQ people and their families across Vietnam. Human Rights Watch say LGBTQ plus people in Vietnam should have access to health information and service without discrimination, and the Ministry of Public Health new directive is an important step in the right direction. The Ministry of Public Health has announced the following orders the Public Health Agency roll out Vietnam. 1. Promote public relations and disseminate information. This is to enable doctors, personnel, and patients receiving service for examination and treatment at the hospital have a correct understanding of same-sex, bisexual, and transgender people. 2. While providing treatment to gay, bisexual, and transgender patients, public health personnel must ensure gender equality and show respect by avoiding discrimination and prejudice against these groups. 3. Don't view same-sex love. Being able to love both males and females and being transgender is kind of disease. 4. Don't intervene or force this patient to be treated. If there is any treatment, it must be in the form of physiological assistance, and it must be the duty of someone who has knowledge and understanding about gender. And 5. Support internal assessments and audit to ensure that the agency provides examination and treatment service, including medical personnel, has followed professional ethics in providing medical service in the accordance with the law. The second policy is Vietnam aims to have universal health coverage in 5 years to cover the entire country. Vietnam's universal health coverage system currently covers approximately 80% of the country's population and set a goal for the entire Vietnamese population to have universal health coverage within the next 5 years. Dr. Wu Ta Nam said that the mechanism for controlling costs, organizing the compensation system, and strong inspections are an important part that Vietnam has learned from Thailand. In terms of compensation for service fees to service unit, Vietnam has implemented the same 3 models as Thailand. 1. Actual payments. 2. Lump sum payment per head. And 3. Payment according to diagnosis related groups or DRG. The Vietnamese DRG system had already developed in version 1, but in practice there are still many problems such as entering disbursement disease codes, defining disease groups, checking disbursement makes it necessary to learn experience from Thailand in order to develop and improve them to be appropriate and consistent with the Vietnamese context. I think that both of Vietnam's policy are good start to the world in both ASEAN and the world community because they are open to gender diversity to be good example for the ASEAN countries, and the importance of the public health system indicates Vietnam's continued development. Other ASEAN countries can also adapt Vietnam's case.
I really agree on Vietnam currently will cast health standard for LGBTQ+, because I'm one of those who support LGBTQ+. This policy is a policy that recognizes the importance of the human rights. No matter what gender you are, You should be treated as a human being. In medicine, there should be no gender or class discrimination in receiving health services because everyone has equal rights.
I would like to know how this announcement that Vietnam currently world-class health standard for LGBTQ+ affect the people in Vietnam.
It was originally proposed that homosexuality be diagnosed as a disease in Vietnam. Misconceptions about homosexuality are widespread. Affecting children and youth, there was a lot of pressure on children to be gender correct. But after the government changed the law, made it legal to change the name and gender of transgender people, it's not illegal anymore. But the amendment didn't lead to legal gender recognition. Vietnam is now part of a growing number of governments around the world, which confirm that same-sex love and gender identity is a form of human experience that changes naturally.
Next, we will talk about the health policy of the Philippines. Aim to improve the health of the people by focusing on providing accessible and quality public health services. These policies are managed by the Department of Health of the Philippines, which had three key policies. 1. Universal health care. 2. Fit health. And 3. Disease control and prevention. 1. Universal health care UHC. The Universal Healthcare System of the Philippines is supported by the Universal Healthcare Act, enacted in 2019. The goal is for everyone to have access to basic healthcare without having to pay more than they can afford. UHC focuses on integrating local and national health agencies to allocate resources and plan strategically for sustainable quality services. There is also financial support from taxes and government funding to ensure sustainable public health services. 2. FIPHEALth. FIPHEALth or the Philippine Health Insurance Corporation play a crucial role in providing health insurance to the public. It covers a wide range of the medical services, from hospital treatment to primary health care, focusing on protecting low-income and vulnerable groups. Programs like the sponsor program for who can pay insurance premium and the Indicant program for poor family help ensure access to necessary medical services. FIPHEALth benefits include covering costs for surgery, medication, rehabilitation, childbirth, and other essential medical services. 3. Disease control and prevention. In terms of disease control and prevention, the Philippines has a national vaccination program focusing on vaccinating children and at-risk population to prevent the spread of vaccine-preventable diseases like measles, diphtheria, and polio. The country manages infection disease, especially those with high outbreak rate like dengue fever and tuberculosis, through educational campaigns and preventive measures for HIV/AIDS prevention. The Philippines offers educational programs, free access to antivirus drugs, and comprehensive testing to reduce the spread of the virus. In my opinion, I believe that investing in a strong healthcare system like universal healthcare UHC, FIPHEALth, and disease control and prevention not only make people live better but also help build a stable economy and society over time. If other Southeast Asian countries adopt similar strategy, it will help them deal with health problems and more effectively and sustainable.
I have a question. What is the difference between the universal healthcare system and FIP health?
USC is a plan to make sure everyone can get basic healthcare without extra cost. FIP Health is a government program that offers health insurance to help pay for medical expenses, especially for people with low income.
You have a good point about the disparity in medical treatment. I'm afraid the above policy may not reach the Filipino people as they should. This is because 50% of Filipino families describe themselves as poor and the country's poverty landscape remains the same. Discuss inequality in the use of this health policy. If the government is unable to solve this inequality problem, I think that access to the health policy mentioned above, it may not be as effective as it should be.
Alright, now you have 1 minute to express your final proposal. So let's start with Thailand. The above is just a part of health policy in Thailand in order to improve the quality of service system to support elderly society, to facilitate public health for the elderly, to facilitate the convenience of the public in treating various diseases, including receiving services without charge under control of the government, and also having a policy to develop health services further in economic aspect so that health products based on Thai wisdom can be developed into the international level.
Singapore is the country with the most successful health insurance system in ASEAN, using a system for people to pay money into the fund every month and plan it systematically. A residential project was planned along with the hospital, so patients would not have to travel far, and a clinic was built to ease the burden on the hospital.
For policy to ensure global health standards for LGBTQ people, it is a policy that provides equality for all genders, including gays, bisexual, transgender people, people who love different genders, or even people who love the same gender. Regardless of gender in Vietnam, everyone is treated as a human being and homosexuality is not considered a mental illness. It can be seen that Vietnam is a country that is developing in a more international way, and the policy that is being developed is the policy aims for 5 years to have universal health coverage covering the entire country. Although this is a developing policy, but if successful, Vietnam people will have excellent access to treatment and public health service because Vietnam has adopted a model for developing and implementing a universal health coverage system from Thailand, which is a country that has already succeeded. It gives confidence that soon Vietnam will be successful as well.
Overall, the health policy of the Philippines shows a strong commitment to creating a comprehensive and sustainable public health system through the integration of universal healthcare USC and FIP health insurance. This policy helps reduce gaps in access to healthcare, especially for low-income and vulnerable population. The Philippines places importance on systematic prevention and control of infectious disease, such as vaccination program and disease prevention. There is also government support through taxation and financial aid, allowing for sustainable health system development. This demonstrates the effort of the Philippines to create a public health system that effectively meets the needs of its people and provide comprehensive coverage.
To sum up, Thailand has good and interesting health policy. There are policies to support medical expense, which are beneficial to the people. However, there are still problems with the current public health system, which is the lack of leadership and governance, which means there are no national leading organization that can set a budget and determine the appropriate number of personnel working in the system in order to procure medicine, medical equipment, technology personnel, and buildings to support medical and public health needs. As the result, the Thai public health system is still in the progress of being implemented and may not cover all sectors of the country. For Singapore, Singapore is the country with the most successful health insurance system in ASEAN, and healthcare is kept affordable for Singaporeans through heavy government subsidies, supplemented by the MediSave, MediShield, and MediFund. What is available to make healthcare more affordable in Singapore. About Vietnam, Vietnam is a country that has entered an era of national development. Vietnam places for importance on gender diversity and mental health, which is considered a universal perspective. This is because some countries in ASEAN may not have developed policy regarding gender diversity like Vietnam, and Vietnam places great importance on access to treatment and public health services. Although it has begun to develop in this area slowly, but beginning to develop policy that give importance to public health may result in Vietnam developing faster. But what Vietnam still lacks in the budget and knowledge and understanding of the people and various agencies. In Vietnam, this is called the implement of various policies to take time, and the Philippines health policy focuses on creating an accessible system through USC and field health, reducing healthcare costs for low income and vulnerable groups. The country has strong disease prevention programs like vaccination. However, challenges include medical resource shortage, insufficient infrastructure in some areas, and management issues affecting rural healthcare access. Continuous development and support are needed to improve system effectiveness. So that's all for today. Thank you for listening. See you next time. Bye.